I'm Dr. Brant Pedersen, and in this video, we're going to go over everything you need to know about sacroiliac or trochanteric belts. An SI belt is a great way to help provide stability to your SI joints, and SI joint pain is a commonly misdiagnosed condition that can cause low back pain, pelvic region pain, even pain into your hips and down your legs. But diving deep into trochanteric belt and the frequently asked questions that I get about them. How do I put it on? How tight do I wear it? How long do I have to wear it? Can I do activities while I'm wearing it, like exercising? Can I wear it when I'm sleeping? Will it atrophy my muscles? There are a lot of different questions. The sacroiliac joints are the joints at the base of your spine here that are made up by your sacrum, this triangle-shaped bone, and your ilium. So sacroiliac joint. It's these joints running right here. You can see them from the back there. You can also see them from the front here. And those joints are held together almost entirely by ligaments. So if you can see here on the back and on the front, sometimes those ligaments get overly stretched. And when they do, we have an issue of SI joint instability. And a great way to help provide stability to that joint and pain relief, if someone has that, is with an SI belt. So putting on an SI belt properly, it's really important. If we're not wearing an SI belt where it's meant to go, we might get little or no benefit from it. And I often see that when patients come back into the office, they're either wearing it too tight, too loose, they're wearing it too high. That's very common. So the belt needs to go around your SI joints. And the way that I teach my patients how to figure out where that is I'll have them bring a leg up, and where the crease is right above their hip, that is where the bottom of the belt is going to go. So when I have them first put it on, I will have them loosen the tensioning straps. This is going to help it so that it doesn't bunch up. You want the belt to be comfortable when you have it on. So if you're not making sure of these things, then it can not be fun to wear. So where the crease is, that's where the bottom of the belt is going to go. And then I'm going to make sure that it is even around so that it's not high up in the back or low in the back, that it's even, parallel with the floor. And that I put good tension on it when I first tighten here. That's going to help so that we don't get bunching. And then what I'm going to do is take and put a little extra tension just into either side. And so we're going to roll that second question in. How tight do I make the belt? Well, you certainly shouldn't have any symptoms that come on with wearing the belt of pain going down your legs or numbness or tingling. That's not something that we would expect. And also knowing that making the belt tighter doesn't necessarily make it work better. It should just be moderately tight. I have my patients be able to put their fingers in there so that it's snug but not too tight. If a person finds that they get bunching in their belt, or that the belt is hanging out down low like this, or that they find crinkles or wrinkles in the material, it means that they either have too much tension on the tensioning straps, or they don't have enough initial tension on the belt before they tension the straps. So start over, loosening those straps, putting the appropriate amount of tension into the belt before you start, and then putting just a little bit of extra tension there. You can wear it underneath your clothes or on top of them. Sometimes people wear a sweatshirt or something, a sweater over the top of it so people can't see. But that is how to put on and properly tension an SI belt. So how long you have to wear an SI belt depends on a lot of different factors. A few of those are your mechanism of injury. How did you first get injured? Did this just come on, not from a trauma or an accident? That's probably going to take less time to heal. If it came on from a severe trauma or accident, those take longer to heal. How long have you had these symptoms and this pain before you started treating it? So someone's had it for a week, less time to heal. But for someone that's trying to heal their SI joint, avoiding those shearing activities help the person not have to wear the belt as long. So the golden question, or the $1 million question, how long will I have to wear it? It really depends on the patient. Sometimes people will wear it for a week or two, but I've had patients wear it 6 months or more. What we're really looking for is a proper diagnosis that the person actually has SI joint instability, someone that feels a relief, because a person should feel when they put on an SI belt, if their problem is SI joint instability, wow, this is exactly what I feel like I've needed. I just feel more safe, more secure. I feel like there's less chance that my back is going to go out. They immediately notice an improvement. And what we're looking for is a patient that gets, or a person that gets, where they feel that I don't have any pain, and even when I take my belt off and I'm going around in my daily life, that I don't have any pain with that. That's what we're ultimately going for, the ultimate goal with anyone with SI joint pain. Will an SI belt create atrophy? No, an SI belt will not create atrophy in your muscles the same way that like a lumbar corset brace would. A lumbar corset brace is kind of designed to take over for your core and help support your lumbar spine. And in doing so, if you wear it for too long, it actually takes and makes those muscles get weak or atrophy in your core, putting you at more risk for injuring your back, getting a disc bulge or a muscle strain. The SI belt doesn't actually take over for any muscles. All it does is help to hold those SI joints together, sacroiliac joints together, and therefore allow those ligaments to come back to their normal tension. So someone that wears it for weeks or months doesn't have to worry about atrophying those muscles. Can I exercise with the belt on? Yes, you can exercise with the SI belt on. I have patients go about their normal activities. So they might weight lift. I've even had patients swim with their SI belt on, go walking, hiking, do whatever their normal activities are. Again, trying to avoid those activities. They're shearing the SI joint. It's another reason to have a good, comfortable SI belt if you're going to be out and be active, gardening or whatever it might be. Can and should I sleep with a trochanteric belt on? Yes, it is fine for you to sleep with an SI belt on. The patients that I recommend that for are people that have pain because of their SI joints at night, or they wake up in the morning having more pain. Those are people that usually do better having an SI belt on when they're sleeping. It is not necessary to sleep with an SI belt on. It's just if it brings you relief.